Hi there. December 2017 saw the introduction of the renewed cervical screening program in Australia and the release of the associated updated cervical screening guidelines. This has presented some management challenge to clinicians as we all try to adjust to the updated guidelines and the change in management. What we're going to do today is aim to discuss some of the more commonly encountered clinical challenges to try and assist us in making sure that we're providing the right test at the right time to our patients with appropriate follow-up in place. All of the cases discussed today and the information are taken directly from the updated guidelines, which can be found at the website shown on the screen now. So our second case today is going to look at the commonly encountered scenarios of follow-up testing following previous abnormalities under the old program. So our first case is a 28-year-old woman who presents 12 months after a low-grade Pap test result under the old program, or sometimes this may have been referred to as a CIN-1 report. So in this scenario, this woman should be offered a HPV test. That's what we would write on the request form, a HPV test. We would include the clinical information of the previous abnormal result in the clinical history on the request form. If this woman then had a negative HPV test, she could be safely returned to 5-yearly screening interval. And we can see on the screen there now the flowchart that relates to follow-up of women with a previous abnormality. It very clearly outlines for us the follow-up testing that would occur in this woman. Our third case today follows on with that same scenario of a woman with a previous abnormality. In this case, we've got our 28-year-old woman who presents having had previous treatment for a histologically confirmed high-grade lesion. She's had a previous LEPS procedure for that, and she had her first test of cure, so a cytology test and a HPV DNA 12 months ago. So for her, we should offer her a second test of cure, and under the new program, this is termed a co-test. So co-test refers to liquid-based cytology plus HPV DNA. On the request form, we will request a co-test and we will write all of the history details there about her previous abnormality and treatment. And then depending on the outcome of that test of cure, her follow-up will then be determined. For a woman to be returned to 5-yearly screening, she needs to have annual co-testing until both results are negative on 2 occasions. And that again is outlined nicely in the flowchart that you can see on the screen there now.